So for our week 5 project, Louis Sally and Cassandra Prince will be presenting the histrionic personality disorder. So the definition of the histrionic personality disorder. Histrionic personality disorder is a mental condition characterized by pervasive and excessive emotional and attention-seeking behavior. Roughly 9% of the general population is affected by at least one personality disorder or another. However, individuals with HPD are estimated to range from 0.4% as high as 1.8% of the population. Women are diagnosed at a higher rate than men, and that could be an overdiagnosis as men were considered to be underdiagnosed because of how society viewed women and their sexual advances towards men. HPD is associated with an egocentric behavior, which means that typically identifying their behaviors as normal and may fail to recognize they have any issues at all. The lack of insight can contribute to underdiagnosis until later in life when behavior patterns significantly interfere with their work, relationships, and just their overall well being. There are several factors believed to contribute to HPD: genetic disposition, childhood experiences, as well as environmental influences. Genetic studies propose a hereditary component associated with HPD. Studies involved also showed that twins would have a higher contributing factor towards HPD. Childhood experiences such as child abuse, neglect, sexual abuse are all significant risks for developing HPD. Higher risks of eating disorders are contributed from having HPD, such as binge eating or purging. Environmental influences. So, medical conditions that are pathologically damage neurons, such as head trauma, cerebral tumors, as well as Huntington's disease, have been contributing to diagnoses of HPD. So, here's Karen. Karen is a 23-year-old white female who works for an insurance company in a call center atmosphere. This is Karen's sixth job in the last 3 years. Karen is an attractive woman who attracts plenty of attention to herself. Karen is always talking about herself and how great she is and how great she's doing. Karen is a very flamboyant, and intentionally dresses provocatively everywhere she goes. Karen has been reprimanded multiple times for having loud, disruptive dialogues at work, and the contents of these conversations are entirely unsuitable for any workplace. She has been loudly heard discussing scenarios related to her dating life and how guys cannot keep their hands off her. Although the situation is uncalled for, Karen consistently draws attention to herself in and out of work. However, when Karen is reprimanded, she becomes overly dramatic and plays the victim, especially when held accountable for her conduct. She makes it clear that she feels that it is everyone against her. Jane, Karen's cousin, who's almost nearly the same age, has become somewhat concerned because of Karen's lust for attention. The content, the constant need or want for attention tends to cause her to make poor decisions that impact her daily function as well as lower the quality of her life. Karen getting drunk during happy hour nearly every day, her manipulative behaviors, she's towards men, and is able to have meaningless relationships with friends, families, and others. Upon Karen's assessment, Karen did come dressed to the appointment a little provocatively with a lace mini skirt and about 8-inch heels. She was smelling of a strong perfume, and the smell of smoke was also pungent. Karen seemed to be dressed clean, well groomed. Did notice that she was chewing a large wad of gum. Karen seemed to be upbeat, free spirited, and very friendly. She did seem a little uncomfortable when the conversations did turn over to her parents, but was quite comfortable when the conversation was about her. Karen spoke at a fairly fast pace. Didn't even notice the time she had to catch her breath. Did notice a notable slur. Karen's thought process was a little all over the place at first. She couldn't concentrate, but was able to calm down. However, she did have some emotional outbursts. At one moment, she began to cry, and the next moment, she was upset. Besides seeming nervous, Karen asked good questions and recalled past details pretty quickly, even when the topics were sensitive. Karen is very impulsive. Karen seeks attention from everyone. She may use sex as a manipulative tool to get what she needs, even if it's just for attention. Karen seems to make poor choices and doesn't believe that her choices have any negative consequences towards her. However, Karen can be pressured to do some things that she really doesn't want to do. Karen does not take accountability for any of her actions. When something goes wrong, it always has to be someone else's fault. Karen is a 23-year-old single white female who has never been married and lives alone in a one-bedroom apartment. She has no kids and does not see herself having any kids in the foreseeable future. Karen has no known allergies and has never been aware of having one. Karen stated that she was a cigarette smoker but still smokes cigarettes only when she goes out, especially if she's drinking. Karen claimed that she smokes marijuana but has quit over a little over 6 months ago after losing her last job as a receptionist at a reputable law firm. Karen last checked her blood pressure at her local pharmacy about 2 months ago while waiting in line and noticed that it was significantly higher than normal according to the blood pressure machine. She stated it was about 140 over 90. Karen also stated that she does not have a current primary care physician currently because she believes that she's relatively healthy and can't remember the last time she was sick and has not been to the emergency room since she broke her arm as a child. Karen stated that she fell in her home when she was about 9 years old. The only provider Karen has seen in the last year would be her OBGYN. Karen stated that her OBGYN does do blood work, and about a week later after she receives the results and normally is a clean bill of health. However, the last time for during her visit, she was made aware that she did have a yeast infection. Karen remembers that she was prescribed an over-the-counter medication known as Azocaine, and it cost her about $15 at her local pharmacy. Karen stated that she started drinking and having sex when she was a sophomore in high school and still drinks almost every day, especially in some sort of social setting. Karen also admits to being promiscuous when she goes out for drinks and stated that she strongly believes in using contraceptives but admitted that certain situations have moved too fast and they were overlooked. Karen did state that she's never been pregnant, but admitted to using the Plan B pill more than once. She also disclosed that she has never felt the need to be tested for any sexually transmitted disease. Karen mentioned that her sexual preference is of the opposite sex, but has experimented with the same sex in the past. Karen has never been evaluated or has even considered seeking any type of mental health provider. She's never thought that anything is wrong with her and continues to feel the same way. She said that she doesn't talk to her family much anymore, and since every time that she was part of a get together, it would always end up in a fight or an argument, and she felt that the family was constantly attacking her. Karen did state that her father was not a great dad, and he was also an alcoholic who was not only physically abusive but as well as emotionally abusive. Karen stated that her mother would pretend that nothing was wrong and flat out ignore her at times, and her two older brothers and younger sisters would receive the same treatment from their father, but she felt that she would get the worst of it most of the time. Karen's brother John and Jacob did confirm that their father was physically and verbally abusive to all of them, including the other siblings as well as the mother. The parents are still together currently, and the father is still drinking on a daily basis. John confirmed that Karen would come over to the family's get-togethers. Karen would seek attention from family members by getting loud, drunk, and obnoxious, usually ruining the days for others. Karen was able to admit that she did consider suicide more than once, um, especially after the altercations with her father when she was younger or a young teen, and most recently after a couple bad days at work, but really never acted upon any of her thoughts. Diagnosis and DSM-5 criteria. To obtain a formal diagnosis, the following must be met: comprehensive evaluation and a thorough assessment. Uh, Differential diagnosis and other diagnoses associated with HPD are borderline personality disorders, which is characterized by an unstable relationship, intense emotion, impulsivity, poor self image, and feeling of emptiness. Narcissistic personality is another disorder that is associated with HPD, characterized by a constant need of attention and a grandiose sense of self importance. Other diagnoses that have been affiliated with HPD are depression, anxiety disorder, and substance abuse disorder. To be diagnosed with HPD, a person must meet the DSM 5 criteria, which include five or more of the following: uncomfortable when not the center of attention, inappropriate sexual provocative behavior, rapidly shifting and shallow expressions of emotion, using physical appearance to draw attention, speech is excessively impressionistic and lacks detail, easily influences by others. Treatments for histrionic personality disorder focus on helping people become more aware of their emotions and behaviors, developing healthy communication and social skills, and elevating their self esteem. Treatment would involve psychotherapy being the primary and the only treatment for HPD. Currently, there are no medications that are specifically to treat HPD. Psychotherapy includes talk therapies, and the goals are of reducing distress, helping people understand their problems as internal conflicts, decreasing behaviors that interfere with their daily functions, changing personality traits such as distrust and manipulativeness. Types of psychotherapy that may be helpful for people with HPD. Cognitive behavioral therapy focuses on identifying and changing negative thought patterns and behaviors. Dialectal behavior therapy structures therapies that incorporate mindfulness, distress tolerance, and emotional regulation. Psychodynamic therapy helps connect past experiences like traumas and unresolved conflicts. Interpersonal therapy examines a person's relationship and identifies thoughts and behaviors that may be causing negative interactions with others.